Welcome back to the Interviewing People Careercast, featuring highlights from last week's full-length interview with Brandi Hoyng, clinical pharmacist at Health Partners of Western Ohio. Brandi shares about the variety of pharmacy programs, how her daily routine might be different from what people might expect a pharmacist to do, the difference between an internship and residency, and much more. So sit back, relax, and know you can always go watch our full interview if you'd like to learn more. Enjoy the show.
My degree is a doctorate in pharmacy. So that's actually how all of the programs are across the board now. It had changed maybe like 10 or so years ago, but now it's a doctorate. So with that, University of Findlay is a little bit different. So it's a 0 to 6 program. So 6 years, you actually are in the pharmacy program right off the bat. So as a freshman, you're in the pharmacy program, and then you kind of just go through like your gen eds and then your pharmacy classes after that. At other schools, it can be a little bit different. So there could be a 2 and 4 program, which is how a lot of colleges are in general. So you do like your pre-pharmacy, which is 2 years. You do a lot of the gen eds and everything, and then you have to apply to the actual pharmacy program, which is then 4 years going after that. So you apply in the middle of schooling there. 6 years is generally the most common time. I know specifically Ohio State is actually a 4 and 4 program, so that's an 8-year program altogether. So, but 6 years I think is just the most common time frame.
Right. And I mean that 4 and 4 with a total of 8 years, is there really anything that a person would get in that program compared to the program that you had for 6 years?
Truthfully, I'm not sure. So I haven't talked to a bunch of OSU grads or anything, so that may be something someone wants to reach out to. But I do not know why they have an extra 2 years. I felt like the Findlay program was well-versed in everything we needed to know going out into the pharmacy world. So I am not sure what happens in those extra 2 years there. Pharmacy intern is usually when you're still in school. I actually worked at Kroger Pharmacy. I worked at both the Krogers in Findlay, actually. And so that is where I worked in the pharmacy. I didn't get to do everything a pharmacist gets to do. I did a lot of tech work, and then I got to do a little bit of extra things. So I guess things like transferring prescriptions from one pharmacy to another, jotting down prescriptions from a physician, those kind of extra little things that you get to do that kind of help you become ready to be a pharmacist in general. So that was how an intern is. And then you can actually be like a hospital intern. So there are some people who go to a hospital and intern there during their college years. So that would be what an intern is. So basically before you become a pharmacist. As a resident, so that was actually a year after I graduated, I had to have my registered pharmacy certificate. So I had to take my boards and everything for the residency position because I'm a full-blown pharmacist at that point. Residency is definitely different though, because it's a lot of projects, a lot of work. I did a hospital residency, so it's much different than doing like a retail pharmacy position. You have rotations every month, and you basically just learn the ins and out of the hospital world, basically. And you have a couple of electives and things like that. It just gets you really ready for the pharmacy world and basically what you want to do after residency. So they kind of explain residency as almost like 3 years of experience because of how much is crammed into that 1 year. It's a lot of work. You do research projects. You do kind of the whole shebang there. So it's a big deal. It's actually kind of crazy because I barely step foot in a pharmacy. So I am what's called like an ambulatory care setting. So I work at a health center, and there's actually 3 nurse practitioners that are there. They each have a team of nurses and receptionists. So they see patients as a primary care provider. So they'll do like yearly follow-ups or physicals. They'll do things like kind of like an urgent care as well. So seeing their patients if they have like a skin infection or something like that. So basically it's kind of like your regular doctor's office. So I am kind of like a specialty for them. So the nurse practitioners will actually refer their patients over to me when they see fit. So I see a lot of patients with diabetes. I see a lot of patients with blood pressure issues, hepatitis C, and like COPD, asthma, and I'll see them as a full visit. So I actually bring the patients in and I do all their vitals. So I'll get their blood pressure, blood sugar, everything that I need to take to make sure that they're healthy in the moment. And then for like diabetes patients, for example, they'll bring in their blood sugar logs and we'll go over those and see how well they're doing at home with their blood sugar. We'll adjust medications at that visit if we need to. And I'll do it under the nurse practitioner. So I'll basically let them know, hey, we're uncontrolled here. We need to increase this medication or we need to change them over to insulin, those kinds of things. And then I'll put the prescription under the nurse practitioner's name over to our outpatient pharmacy that I don't really touch. So, so I get to work really closely with patients. Actually, it's a really fun thing. I really love that aspect about my job, and I get a lot of independence with it as well. So I do the same thing with my blood pressure patients. With hepatitis C, they're on really expensive medications that usually don't get covered by insurance. So I work with them on how to get that covered by insurance and use all that documentation that I do with them. And then for my lung condition patients, so asthma, COPD, I actually do what's called spirometry. So they basically blow into a mouthpiece that's connected to a software, and I can diagnose them with asthma or COPD through that. And then we go over, are they on the correct inhalers? Do they need extra medication? What kind of things do we need to do going forward? So basically, do they need to see a lung doctor? Is there something else that's underlying? So I actually get to do a lot of hands-on stuff, and it's a really cool setting, and it's something that people don't usually know about pharmacy. My name tag says, Dr. Hoyng, PharmD on it, and then I get asked all the time, wait a minute, you're a doctor? And I'm like, well, a doctor of pharmacy, I'm a pharmacist, and then they get even more confused because I'm a pharmacist and I'm not giving them pills. So, so that's definitely different than what the norm is. I do handle pills in some sense though, because med boxes. So patients that are truly non-adherent and maybe they're on 20 medications, I will set up monthly med boxes for them. So I bring them in once a month. We go through and I fill all of those up for them. And those patients too will also have underlying conditions. So I can make sure I make those changes to their medications if need to in the moment, and I can change them immediately in their med box. So it's a really cool thing. It's a really cool setting, and I love sharing that part about my job. So it's really cool. Retail pharmacy is probably going to be your higher paying pharmacy. Truthfully, it's the long hours that'll get you, and they know that it's not sometimes the best work in terms of like quality of life in general. You're just working at the pharmacy quite often. So whether that's like 12-hour shifts, or you're working weekends, those kinds of things, they know that people aren't exactly a fan of that at times. So they do offer, I guess, more in terms of salary than what I would do. However, no matter what career field you go into for pharmacy, it's always going to be a really decent size salary. So I wouldn't really expect anything super low or anything for any kind of pharmacy. So, you have your doctorate, you get basically in the six figures for most pharmacy positions.
Right.
There's so many things you can do with pharmacy. It's unreal. So I had a plan of what I was going to do as a pharmacist. I was going to, maybe just do retail pharmacy. I didn't know if I really liked the hospital. It seemed kind of scary to me at first. And then you get into pharmacy and you learn all of these different things, and you start doing your module classes, which is your actual pharmacy classes. And you realize that it's so different than what you were expecting. And then you start realizing, oh, I really like this about this topic. How can I do this more in my everyday life? So that was a huge thing for me, was just learning what all you could do.
Thank you for watching this episode showing highlights of the latest Interviewing People CareerCast with Brandi Hoyng. And to make your Mondays better than ever, subscribe so you can hear more career stories from those who are actually doing the work. Thank you for watching, and as always, remember that the best part about Mondays is interviewing people.